Last week I said that the county health department would be offering free tests to nursing home staff. This is true. We have begun queuing the COVID negative long-term care facilities and offering to provide testing to all of their employees. We start with the first location, I believe, started today. Yeah, this morning at 8 o'clock, I think. We're working with an EMS provider that we're contracted with, and then working very closely with LabCorp and the state public health laboratory to get those testing supplies and the PCR test conducted, and the long-term care facilities are doing their part by lining their workers up and filling out paperwork in advance and all of that. So we have begun that. It started today, and we will continue to provide that until we can get every employee at long-term care facilities tested at least once, so that we can gather some information with which to make some decisions about the need for ongoing testing, ongoing surveillance for COVID and employees through PCR testing. Yes, so that's how it works. Again, we have 27 or so facilities that are currently COVID free, and it takes time. So we don't think we would be able to, do more than one or two or maybe three a day. So as you can imagine, it will take some time to work through everyone. And then how many tests are performed, it depends on the number of employees that they have. And right now we're just going to try to get through all of the facilities and then make some decisions about additional testing based on what we find. You have to imagine, this is it's a need for the facilities, yes, but it's also very challenging for them. If they have staff that test positive, then they almost instantly have a reduction in workforce and have to move to contingency planning for staffing. So they're partnering with us. Most of them are open to this recommendation and are either doing it themselves. Many of them are doing it themselves, but those that want to accept our assistance, we are happy to partner with them. So if an employee tests positive, then the guidance is that employee, if there is enough staffing to maintain the critical care of the patients, then the employee would go home for 10 days if they were asymptomatic, and longer if they became symptomatic. But if the staffing model gets so low, and this has been a CDC recommendation from the beginning, then contingency staffing plans include things like, continuing to work healthcare workers that are asymptomatic but have a positive test in certain areas of the facility and under certain conditions, as of wearing a mask and those sorts of things. There's a whole big old long list. So this is what has been going on since 2.5 months ago. We've been following CDC guidelines when we have a potential shortage of staff in a long-term care facility.